What does the research say about CISD? When we talk about Critical Incident Stress Debriefing, or CISD, it's important to understand what it is and how it relates to trauma, especially for veterans dealing with post-traumatic stress disorder. CISD is a structured group intervention aimed at helping individuals process traumatic events soon after they happen, usually within 24 to 72 hours. The goal is to reduce the risk of developing PTSD and other stress-related symptoms by offering psychological support and education about normal stress reactions. Research on CISD presents a mixed picture. Some studies suggest that it can be beneficial, particularly for emergency services personnel who frequently encounter traumatic situations. For instance, certain reviews have indicated that CISD may help lower the risk of PTSD symptoms in these high-risk groups. However, the overall effectiveness of CISD is still debated. A significant amount of research, including meta-analyses and systematic reviews, has not consistently shown that CISD, or psychological debriefing, effectively prevents or reduces PTSD symptoms after trauma. One reason for this inconsistency is the methodological challenges in studying CISD. Conducting randomized controlled trials can be difficult due to ethical concerns and the unpredictable nature of trauma. These challenges contribute to the variability in research findings. Critics of CISD point out that many supportive studies lack control groups, randomization, or standardized intervention protocols, which weakens the evidence base. Major health authorities and scientific reviews generally conclude that there is no strong evidence supporting CISD as a standalone intervention for preventing PTSD. Instead, CISD is often part of a broader approach known as Critical Incident Stress Management, or CISM. This includes various components such as pre-incident training, one-on-one crisis support, and diffusing techniques, aiming to create a comprehensive system for managing stress. While CISD may provide immediate psychological support and help normalize trauma reactions, it should not replace established, evidence-based treatments for PTSD. Veterans and others affected by military trauma benefit most from individualized care plans that incorporate proven therapeutic approaches, such as trauma-focused cognitive behavioral therapy or pharmacotherapy, alongside any crisis intervention methods. In summary, research indicates that CISD is a structured group process aimed at early intervention after trauma. Some evidence supports its use among emergency personnel to reduce PTSD symptoms, but many studies do not find consistent or convincing evidence of its effectiveness. Methodological limitations and ethical challenges complicate research on CISD. It is often part of a broader CISM program and should not replace established PTSD treatments, though it may serve as a component of early support. More high-quality research is needed to determine which aspects of CISD, if any, are beneficial.